And as India battles the second wave, many big companies across the country stepping in, global giants stepping in to ensure that India fights the pandemic, one, and second, emerges stronger. And as part of our Stay Strong India campaign, we have a special guest joining us this evening on the broadcast from Hyundai Motors, which is doing its bit to help India fight and fight back harder. Let me introduce Puneet Anand, who's the Assistant Vice President of Corporate Affairs at the Hyundai Motors. Puneet, thank you for joining us here on Republic TV. Good evening.
Good evening, Mr. Niranjan. Good evening. Thanks for having me on Republic TV today.
Nice to talk to you. Why don't you tell us a little bit about Hyundai's initiative? I think, you've called it Progress for Humanity, and as part of your efforts, what are the different steps, measures, initiatives that Hyundai is undertaking?
Well, first of all, Niranjan, thanks for having me on the show today. And first of all, I'd like to, give my regards to our fellow countrymen and also to the frontline warriors, our doctors, our nurses, our frontline staff who have been working very hard overtime, supporting our nation, the health of the people, and also ensuring that the precious lives are saved. In fact, just to share with you at Hyundai, our vision is very clear: progress for humanity. And it is with this vision that not only this year, but even last year when we had faced this pandemic, we had left no stone unturned in terms of ensuring that not only we come to the support of the people in terms of the lives, but also ensure that the livelihoods are also maintained. This year, in fact, in the month of April, when this pandemic started to build up, we had initiated our phase 2, the Hyundai Care 3.0 program immediately. And on 27th of April, it was when we rolled this program on a pan-India basis. Just to understand and share with our audience, actually this time the challenge which we are facing has not been the one which was in the last year. Last year it was more so in terms of the grassroots level, sanitizers, masks, PPE kits, dry rations, food packets, employability. But this year the situation is little different in terms of the infrastructure. Because of the various reasons of this virus taking very much viral, there has been a major concern related to the supply of not only oxygen, but also oxygen-related equipments. So we did a very deep study with our people, with our doctors, and also with the society. And it is with this that we rolled out our Hyundai Care 3.0, wherein we have envisaged supporting various states by supplying them Medicare equipment, largely on the oxygen front, whether it is in terms of supplying oxygen plants to various states, whether in terms of supplying high-flow nasal oxygen equipments, which we call as HFNOs, or also in terms of BiPAP, which are called the non-invasive ventilators, which are helping our people as far as the ICU support facilities are concerned. At the same time, for the people, oxygen concentrators have become quite important. So we are also supporting the nation through oxygen concentrators. And finally, for the last mile connectivity, setting up big oxygen plants in hospitals where there is no captive oxygen available. That's our another initiative which we've taken in the Hyundai Care 3.0. And I'm very sure with the support of the government, with the support of our people, we will be able to overcome this pandemic with the common family background as far as progress for humanity is concerned. So that's in nutshell our Hyundai Care 3.0 programs.
Yeah. Just going through some of the details that we've picked up about the Hyundai Foundation initiatives. During the first wave, of course, distribution of masks, sanitizers, essentials, sanitization drive in rural areas. Rural areas we're seeing are some of the worst affected. In fact, need a lot of attention when it comes to infrastructure, medical help, etc. Now, tell us a little bit about your programs, Sparsh, Sanjeevani and Saksham. What are they and how are they helping the cause?
Well, I think I'd just like to, share our audience. This is very important. When this first wave came, we realized that in the cities, the medical facility can come automatically because of the various focus and the support by various private organizations, governments, state bodies, so on and so forth. But it's the rural India where the challenge is, because the deepness and the length and breadth of our country may not allow everybody to reach to that strong level. So we initiated a very unique program called Sparsh Sanjeevani. And as the name suggests, Sparsh Sanjeevani has two pillars. One is called the mobile medical unit and one is called the telemedicine unit. So in this year, we actually already rolled mobile medical units in state of Rajasthan And very soon we are also rolling out in states of Gujarat, in West Bengal, Maharashtra, Assam, Northeast states. This mobile medical unit will be catering to certain villages. Like for example, in Rajasthan, there is a district called Lakshmangarh. Lakshmangarh, our mobile medical unit is doing the services, and it is visiting 16 villages attached to that district. And these 16 villages are being approached. Our doctors, our nurses, frontline staff are going to the heart of our hinterland, meeting the people, sharing with them what are the concerns and what can be done in terms of giving them support in terms of medical facilities. So that's what mobile medical unit is there. And currently we have around 6 mobile medical units running across the country. These are vans which are equipped with full support, both for COVID awareness as well as for the life-saving devices and drugs. The second program which we are envisaging under is called the telemedicine clinics. In fact, we already opened 2 telemedicine clinics. These telemedicine clinics basically are calling the patients to them and through video conferencing, through reputed hospitals. Like in Rajasthan, we have tied up with SMS Hospital. The doctors of Savai Mansingh College, the hospitals are giving support to the people in hinterlands. Similarly, 10 more states will be equipped with these telemedicine units, and 20 to 30 telemedicine units will be further set up. So these are some of the initiatives towards the rural area, because unless and until we do not reach to the hinterland, I think our entire theme of supporting the country will be lost. Because in cities, you can get support, but in villages, we need to go deep. And that's where our mobile medical unit and telemedicine clinics under the Spurs Delivery program will give a very strong support to the rural community.
Yeah. Now, as far as the need of the hour is concerned, which of course is oxygen, and you being an automobile company, we hear you're playing a big part in ensuring that some of these supplies are delivered and in time. Tell us a little bit about that. How are you helping essential supplies and supplies, critical supplies, reach their intended destination? And secondly, how are these supplies supporting hospitals and the medical infrastructure in this hour?
Well, actually, as I said, on 27th of April, when we had announced our program, by that time we had already contacted some of the major vendors who are across the country, whether it is in Maharashtra, whether it is in Tamil Nadu, whether it is in Delhi. All these suppliers of these life-saving equipments were contacted, and we placed our advance orders to them. For example, immediately this week, we already started delivering our life-saving HFNO machines to the state of Maharashtra. It is already distributed in Nagpur. We are donating it in Pune. It will be going to Nasik. This week it will be given in Haryana. Then it will be going to Tamil Nadu. So from that purpose, we know that time is of essence, and that's why logistics, which can become a major problem as far as the supply is concerned, that also we have taken care of. So I think speed and the depth of the analysis of the situation is very important. And that is where our initial support is to ensure that the hospitals and especially the COVID centers, which have been set by the state governments, should immediately get equipped by these life-saving equipments. Very soon, our another initiative, which is called the BiPAP machine, which is basically
Yes.
a non-invasive ventilator, that would also be reaching hospitals in the state of Maharashtra, Karnataka, Tamil Nadu, Telangana, Haryana, and Delhi, and where all these hospitals will be using it. And the third thing I said is the oxygen concentrators,
Yeah.
which can be used for a patient who's yet to become little serious. So these are basically home solutions. So we have already ordered around 700 oxygen concentrators, and next week this also will be supplied across the country. So we feel that with the speed, with the support of the community and of the medical fraternity, I think we'll be able to ensure that all our supplies and deliveries are concluded within the month of May itself.
Mr. Puneet Anand, thank you first of all for all the good work that you're doing in helping India's fight. And secondly, thank you also for speaking to Republic TV. Stay Strong India is our campaign, and it's heartening to see everyone doing their bit to pitch in and ensure that we get out of this stronger than we did the last time around. Thank you, Puneet.
Thank you, and wish you all the best for your, support. And I would like to personally thank Republic TV for bringing the grassroots level information to the people. Because what I feel during these times, many false narratives can be created. But I
Yes.
think hats off to Republic TV that you are bringing the grassroots information, and it is with the support of the media and with the support of industries and with the government. I think all of us will be able to come down on this pandemic, and as a society, as a family, we will live towards a better vision, the progress for humanity.
Thank you for
Thank you
that,
so
Puneet.
much.
Thank you.
Thank you. Thank you.